Thank you.
Good afternoon, everyone. I'm Barbara Ferrer. I'm the Director of the Department of Public Health for the County of LA. And as always, I'm here to make sure I provide you with an update on the number of cases here in LA County and also try to address some of the ongoing concerns. I do want to start today with a note that we're reporting 40 new cases, which means the total case number is 230 for the County of LA, and that includes the 10 cases reported in Long Beach by the City of Long Beach Public Health Department, and the 2 cases that are reported by the Pasadena Health Department. Unfortunately, today I'm very sad to report that we have had an additional death here in LA County, which brings the total count to 2 deaths here in the county. And I want to express my deepest condolences to the families and friends of the person who's deceased. I'm so sorry for your loss, and I hope that you know that we as a community are mourning with you. The person lived in a community, a small community in an area near Pasadena. The person was a relatively young person between the ages of 30 and 50. And the person had an underlying health condition. All the confirmed cases that we have are being isolated, and close contacts are quarantined. And as always, we will post by the end of the day today a report of the LA County case counts on our website, www.publichealth.lacounty.gov. As a reminder, we're going to continue to see an increase in positive cases over the next 4 to 12 weeks, but that doesn't mean that the important actions that you're all taking to combat this virus are not working. Social distancing is critical, and we implore you to take seriously everyone's obligation to limit their exposures to others and to limit others from being exposed to you. This is the one way that we all can be serious about what it means to try to slow down the increasing numbers of cases here in the county. Because COVID-19 is widespread, as a general rule of thumb, you should assume that you may be infected and that others around you may be infected, and therefore act accordingly. Take every precaution possible to avoid infecting others and to avoid becoming infected. That's the goal of social distancing. If we all adopt this mindset and we act accordingly, it will slow the spread of COVID-19, and it will keep you and your family and those most vulnerable in our communities safer. Everyone should remain at home as much as possible. Feel free to take that walk, hike, or run, just not with a group of people. Those who can work at home should work with their employers and make those arrangements. And we recommend that as much as possible, children should be cared for in their homes. So make arrangements with your employers and try to get a trusted babysitter when needed. We always ask that you continue to adopt our best public health hygiene practices, and I particularly want to emphasize that when you do go out, it's important for you to wash your hands before you leave, and it's important for you to wash your hands as soon as you get back. If you don't have hand washing facilities nearby, this is a good time to use sanitizer. I want to give a testing update and appreciate that folks are anxious to get the numbers. And I want to let people know that we have 7 labs that are currently operational and serving LA County, and that these labs have multiple sites where they are testing lab specimens. So our capacity is still increasing every day here in the county, but I want to remind people that it's limited. As of as of yesterday, we had performed lab tests on over almost 1,700 people. So you can see that every day we are increasing the numbers. And I do want to let folks know that on average, for all of the lab specimens that are tested, about 13% of people who have a test are positive. It's slightly higher for those who are tested through the public health lab and slightly lower for those that are tested on the commercial labs. At the public health lab, about 21% of the people who are tested in our labs end up being positive, and in the commercial labs, it's about 10%. We know that there's a desire amongst many for universal testing, but I want to note, even as capacity increases, you will still need to talk with your provider, and your provider will need to determine that it's clinically appropriate for you to be tested. In general, that means that people with no symptoms of respiratory illness are not going to be tested. If your test was negative today and you were asymptomatic, you had no symptoms, it says nothing about where you would be tomorrow or the next day. So for people who have no symptoms, we ask that you allow the testing capacity we have here to be used for those who are at most risk and need to be tested in order for them to get the clinical treatments that are highly appropriate. Even if you had close contact, and I want to spend a minute on this, even if you're identified as a person who had close contact with a confirmed case and you have no symptoms, you don't need to be tested. If you're the contact of a person who was a close case, you have to quarantine for 14 days. You have to. It's a mandatory order. That means you have to stay out of circulation. You have to not be in any contact with other people for 14 days. If you were to test on day 5 and that test result came back negative, you still have to quarantine for the entire 14 days. The incubation period for COVID-19 is 14 days, and that means that you're going to need to stay quarantined for the entire 14 days. If during your quarantine period you develop symptoms, then you'll be talking with your provider, and you would be an appropriate candidate to in fact be tested. But we need to test people who have the symptoms of respiratory illness. I want to also spend just a minute on sort of how we're going to take care of each other during these really very trying times, and how important it is to remember that this pandemic has a human side. And that human side really asks us all to do our best to take care of each other and to take care of ourselves. If you or your family member have mild symptoms, you've heard both me and Dr. Galley acknowledge that you could take care of yourself and other families who have mild symptoms in your home. And I know people have a lot of questions about what does this mean and what should I do in my home if I do have mild symptoms. One thing for sure is you need to rest, hydrate, drink a lot of fluids, and if possible, and you can tolerate, if you have a fever, you can take Tylenol if it's safe for you to take. Some of you are on other medications, and you will know that absolutely you should not be taking Tylenol. And if you have questions about your particular situation, that's when you should make that call to your provider. You should isolate yourself as much as possible for others, even others in your household, for 7 days. And what that means in particular is no sharing of utensils and cups. You shouldn't be sharing food. You shouldn't be preparing other people's food. And if you're the caregiver in that house, you take care of children, you should see if you can arrange for another person to help provide care for children, particularly young children. If you do need to care for children because there's nobody else, you need to take precautions. This would be a good time to use a surgical mask if you have a lot of coughing. It's a particularly important time for everybody to be washing their hands, and again, for doing as much distancing as you possibly can. If you have other members in your family that are ill, we ask that you do the same, particularly to try to isolate people from each other so that sick people in the family for 7 days are kept as much as is possible from having close contact with other members in your household. This is particularly important if there are people who are older living in your household or if there are people with underlying health conditions. Not only do we need to take special care if people at higher risk of severe illness get sick, but we need to take a lot of care to make sure if there are sick members in the family, they're kept as far apart from those who are most vulnerable in your household. I do want to remind folks that the recommendation is very serious for people who are older and people who have underlying health conditions. They should be staying at home, and we all should be doing our part to make it easy for them to have everything they need to stay at home. They should not be going to the grocery store. They should not be needing to go to the pharmacies to pick up their medications. We can all help with that. The county will help with that by making sure that we're checking in on people we know who are older or home with underlying health conditions and taking that burden off of them so that you can drop off groceries on someone's doorstep. You can arrange to go and pick up needed medications. We're all going to need to help each other in order to be able to actually adhere to the social distancing requirements that at this point are absolutely essential if we're not to see a rapid rise in many, many more cases than we need to see. We can actually reduce the number. We can't go to zero at this point in time, but we can definitely slow the spread. But it takes every single person to do everything they can to take precautions all day, every day, with everybody they're in contact with. And I want to close by saying, if you're feeling stressed and overwhelmed, and I know so many of us are, I'd like you to know that there is a phone line where you can call. It's 24/7 services by our Department of Mental Health, their Access Center. It's 800-854-7771. That's 800-854-7771. And as always, we will deploy really good information on our website. It changes all the time. We provide updates, so that's publichealth.lacounty.gov. And now I'm going to turn it over to Dr. Galley, who's going to talk more about how our healthcare system is getting prepared.
Good afternoon. I'm Dr. Christina Galley, the Director of the Department of Health Services. First, I want to extend my thanks to all those healthcare workers and first responders on the front line. I know you are all working very hard, and we are so grateful for your continued service. I also want to extend my condolences to the family of the individual who passed away. We all do indeed mourn with you. We know that this is an incredibly difficult time, and we share in your sorrow and are very sorry for the loss. Our healthcare system is only as strong as those who provide the care on the front lines every day, and we need to protect both the system and the people who work within it. The best way to do that is to practice the social distancing guidance that has been put out by the Department of Public Health and that Dr. Farrar has described. Social distancing, staying at home when you can, limiting your contact with groups, limiting events, closing stores as needed is the best way to help keep separation between people and make sure we're not accelerating the spread of the virus between one another and in the broader community. It's absolutely essential in order to help protect people that have underlying health conditions, people who are pregnant, and people who are elderly who are at particular risk of adverse complications from the virus. We, at this point, as we know, we can't contain the virus. We can only stop its spread and help mitigate its spread over time and mitigate the consequences on individuals' health and life. So please follow all the guidance that you hear here and in other settings, the guidance that's on the public health website, and practice social distancing to the greatest extent possible. It's also critical that we continue to preserve 911 and emergency services. So please, as I've mentioned before, don't go to the hospital just for testing. Hospitals and 911 system and the emergency departments need to remain available for those with medical emergencies. Please, if you feel like you might be a candidate for testing, call your provider so that they can discuss with you the specific conditions, your underlying health history, and whatever situation you might be in your symptoms, and they will provide you with guidance. If you need help finding a provider, you can call the county's 211 system and they will assist you. Also, we still, as I've mentioned before, urgently need blood products. So I would encourage all those people who are healthy and are able to give blood to consider doing so. We still have a critical shortage of blood products across Southern California as well as the rest of the nation, and we need people to come forward and be willing to donate blood. It is safe to do so, and that blood could save a life for someone who needs it. So please contact the local American Red Cross. You can visit their website, you can use their app, and they have listings of available donation options near you. In terms of the latest bed capacity, the data that I'll report as per usual is based on self-reports from the hospitals across the county and the 911 receiving centers located in a geographic breadth across the county. The data is self-reported on a daily basis to the Emergency Medical Services Agency. There's about 22,000 beds in the county. Of those, about 2,200 are ICU beds. As of this morning, there were about 870 open non-ICU or non-intensive care unit beds and another 185 open beds that were of ICU level of care or intensive care unit level of care. Within the Department of Health Services for acute care hospitals, we run about 1,500 beds. We are operating still at about 69 to 70% capacity, meaning that we have currently about 460 beds available. Of those, about 184 beds are ICU, and of those still, about 52 are open for an overall occupancy rate in the ICUs of about 65%. Within the DHS system, our hospitals are still preparing to be able to flex different units within the hospitals to be able to meet anticipated increases in demand in the near future. Other private hospitals are doing the same. This is called bringing hospitals up to their surge capacity or implementing their surge plans. For those who aren't familiar with this term, surge planning is what hospitals routinely do when they anticipate or are actually facing higher volumes of patients than what they would be normally able to provide services for under normal working conditions. There's a variety of ways in which hospitals do this, and the hospitals across the county, as well as within DHS, are taking those actions as are deemed necessary. State and federal government are also working to bring on other levels of care online so that we can accommodate the demand in the near future. This includes a mix of different levels. This might include acute care, lower levels of care, as well as opportunities for isolation and quarantine for those who need it and don't have an alternative place to go. The EMS agency also continues to work with our state and our federal partners to make sure that they are processing the increase in stockpile equipment that is being delivered, and they are distributing that out to providers and first responders on an as-needed basis. In closing, let me just say what I know we all know and feel is that these are unprecedented times. We need to follow the guidance of our public health experts. That is the best way to flatten the curve of this pandemic and make sure that the volume of cases comes in a way that doesn't overwhelm the hospitals and the health systems who ultimately will care for the individuals who have serious symptoms as a result of COVID-19. So thank you so much for following that guidance and for practicing social distancing. With that, both Dr. Ferrero and I would be happy to take any questions there are.
Ladies and gentlemen, if you wish to ask a question over the phone, please press 1 and then 0 on your telephone keypad. You may withdraw your question at any time by repeating the 1-0 command. If you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you have a question, you may press 1 and then 0 at this time. And it looks like we have about 8 questions in queue. It'll just be one moment for our first question. And our first question comes from Carla Hall. Please state your media outlet followed by your question.
Hello.
Carla Hall, please state your media outlet followed by your question.
Hi, this is Carla Hall from the LA Times. You probably know that the city is going to set up 6,000 beds of shelter for homeless people across 42 rec centers. And what I'm wondering is, even though, as Dr. Ferrer has said, it's better for people to be inside than outside, I'm wondering if that's creating the exact kind of congregant living situation with more than 10 people that we've all been told to avoid.
Yes, so it's a great question, and I think we've talked about this before, so I want to just reiterate a couple of things. One is that there are many people in congregate living situations, and that's a good place for them to be. There's lots of elderly people in congregate living situations, and there's lots of, there are folks who may be living, certainly folks who are in the universities who are still staying in their dorms are living in congregate living situations. The issues is particularly complicated for people who are homeless. Our data shows very clearly that your risk of dying of anything if you're unsheltered is much higher than it is if you're sheltered. This is particularly true with COVID-19, whether we're having underlying health conditions puts you at significant risk for having more serious illness than for those people who may not have underlying health conditions. The other issues that I think are important to take into account is the need for people to have access to hand-washing facilities and adequate social services and medical services so that if they are feeling ill, we're able to quickly do those assessments and move people to the more appropriate settings. You can set up, and I know that all of the sheltering sites that are under consideration here in the city and in the county will be setting up their sites with as much social distancing as possible and as many precautions as possible for us to take. Because, just because people are coming into a congregate living situation doesn't necessarily mean we're creating the conditions that are going to guarantee that this would be sort of ripe for an outbreak. What it does do is it allows us to be able to supply every single person who is trying to come in, wants to come in, with the basic public health strategies that make it possible for them to be able to obtain the kind of care they may need and take the kind of precautions we're asking other people to do. If you're staying in your tent and you don't have any access to wash your hands, my message about how important it is to wash your hands doesn't make any sense. And if we tell you that when you're sick you need to contact a healthcare provider and you don't have one, and nobody actually even knows that you're sick because you're isolated in your tent, it's not helpful. We have to do everything we can to create situations where we absolutely bring people in to places that have social services and allow people to live with the dignity that we'd all like to have. And that includes access to your basic necessities. And it's more important than ever during this time for us to actually figure out ways to do this and do it as rapidly as possible. I want to actually applaud both the city and the county for taking seriously the need for us not to allow people to live in encampments, in particular in close quarters with each other, forced to share lots of utensils and cups and food because of the conditions in which they're staying. So I want to say that I'm very grateful that we're able to offer this opportunity for as many people as we can. We'll take the next question.
Thank you. And next we'll go to the line of David Rosenfeld. Please state your media outlet followed by your question.
Yeah, hi, thank you. I'm with the LA Daily News. I have a couple of questions, if I might. First off, do we have any more information about the makeup of the list as far as exactly how many are hospitalized, what possibly is the age range of the individuals that are confirmed, and possibly how many have recovered so far?
Yeah, I
And
think.
also in regards to the,
Sorry, David. I think that we're hoping that today what we're able to post on our website, hopefully before 5, is exactly some of the questions you're asking. The hospitalization data is a little harder to get now that there are so many different labs that are reporting, and us just trying to track down if people, it's not just a question, were they hospitalized when they were diagnosed? That's pretty straightforward. The issue is, were they hospitalized at some point during their isolation, at some point during the time that they were isolated. So we're trying to see how we can get the most accurate information, and that's going to require a little bit of a shift in our reporting from the hospitals. I want to say at the beginning, when we only had a handful of cases, we were very good at this because we could actually make all the calls and track everybody down in great detail. That's getting harder and harder to do. So we apologize, but we are planning on having a system that will allow us to be able to give more accurate information on hospitalization. But I think you should see today the age groups. So the hope is that what gets posted today will, in fact, give you that information around the positive cases that we're seeing by age group. So you should look for that later today.
Thank you. And if you don't mind, on the testing site, has anything changed with the guidance on that? I mean, you still have to go through your doctor, and are you going to provide perhaps a list of these sites, or is that even valuable if people still have to consult a physician?
It's a good question. Yes, people do have to go through their physician. It's like any other lab order. You'll need a lab order, and it comes from your physician. So yes, everyone who wants to get tested needs to talk with their physician, and then they and their physician will make a determination whether the test is clinically appropriate. And if that decision is made that yes, it is, just like you noted, the clinician will make sure that that person either has their lab specimens collected at the same site where the physician is, or if the physician isn't able to do it, they will send that person to a site that can collect the specimen, and then those specimens will be sent to one of the labs. Now that there's commercial labs, many of them don't come to the public health department. I guess we'll take the next question.
Thank you. Next, we'll go to Jim Roop. Please state your media outlet, followed by your question.
Thank you. Good afternoon. Jim Roop with Westwood One News. And we appreciate this daily briefing, by the way. We know how intense it must be to ask questions and have to answer questions about a virus you're learning about in real time. My question is about this homeless situation. If indeed we are providing, the county and the city are providing housing for the homeless who might be infected, when this is over, what happens to them? And if the hope or the plan is for them to remain in housing, exactly what is the plan to facilitate that?
Sure. I mean, I would say that that question is probably best answered by Kevin McGowan and leadership. I mean, I think everybody right now is just really working as hard as we can to make sure that we can provide as many sheltering spaces for folks who are experiencing homelessness. And I want to differentiate that there's two kinds of capacity that we're building up right now, and the sites will look a little bit different. There's the capacity that's particularly important for us to have for people who we know are elderly and people who we know have underlying health conditions who are experiencing homelessness, and that is to try to get them into a sheltered facility. The other question that you were, the other note that you mentioned, and I think it's an important one, is there are some people who may be experiencing homelessness who may have a test, and we may determine that they're in fact themselves positive for COVID-19, and they have some close contacts that we've identified. And I want to assure everyone, in that situation where there's a person who's positive, they would not go back to that congregate living situation at the shelter. They would, in fact, go to housing that's being set up that would allow us to actually do what we ask all of our cases and close contacts to do, be able to actually isolate yourself, and if you're a close contact, be able to be quarantined for 14 days from your last exposure. Obviously, wherever those sites are set up, we will also have services so that people can do that safely and have all of their important essential needs met while they're being isolated and quarantined. This is similar to what we ask every positive case to do and what we try to ensure that positive cases and people who are quarantined are able to do. But I thank you for your question. And I also want to acknowledge and thank the media for really covering this issue with both great depth and great accuracy. We really appreciate that. But we'll take the next question.
Thank you. Next, we'll go to the line of Dave Lopez. Please state your media outlet, followed by your question.
Yes, thank you very much. Dave Lopez, CBS 2 News, Channel 9 News. Two quick questions, if I may. Doctor, can you comment how much faith do you have in this experimental vaccine that the President made reference to today? And will it be enough to slow this down?
You know, the best tool we have sort of in our toolkit in public health is when we can vaccinate people against the disease. So, you know, we all are anxiously awaiting having a good vaccine. And I think as everybody has mentioned over and over that we're really excited when there are promising results, but you need to actually go through a fairly rigorous testing process before we'd be able to offer that to the millions of people who would need to be vaccinated. I just want to really thank the scientific community, the researchers, and some of the funders who have really given a lot of money to accelerate our ability to develop a vaccine. I mean, I always tell people we're doing a lot of social distancing because we don't have a vaccine. Vaccinations actually provide us with a similar tool, an ability to protect yourself and protect people around you. In the absence of that, we have to go to the social distancing. But thank you for your question. Next question.
Thank you. Next, we'll go to the line of Annabelle Manaz. Please state your media outlet, followed by your question.
Hi, I'm with ABC7. So the first question is about the number of people that are still out and about. We've heard of hiking trails that are crowded, beaches in Florida as well, many of them young people. So if you have a message for young people who maybe are not concerned about having serious symptoms, what is your message to them as far as protecting themselves and other people? Also multiple questions. The second part is about masks. The CDC, we understand, is saying that healthcare providers can use as a last resort a bandana or a scarf as supplies run short. So where does the county stand right now with masks as well as staffing in hospitals in the county? And the very last question for now, Everlywell, a company announced that it is going to be offering at-home testing for COVID-19. Do you have a position on whether you would advise someone at home to do that or not?
Okay, great. I will take the first question and the last question, and then I'm going to ask Dr. Galley to address the questions around masks and staffing. So young people, I think, and I'm really glad you raised this, you know, the unfortunate news that we announced today about having our second death in the county was from a person who was relatively young. And while this is not the usual experience across the world and even across the United States, it absolutely is true that there are many, many young people, particularly between the ages of 18 and 40, who are infected themselves, who are having illness, and some of them serious illness, and who, as we've just unfortunately had to report, can die. So I urge young people to take hold of this opportunity that you have in front of you to really do what's right, not just for you, but for everybody who's around you. This is not the time to have a party at your house. This is not the time to go hang out with a whole crowd of people at the beach. This is not the time to be crowding up on our trails, in our beautiful parks. This is absolutely the time for everyone to practice social distancing. This virus has infected thousands and thousands of people all across the world, and a large number of them are people who are young. And for those young people who don't necessarily have serious illness, I can promise you that they're passing it on to other people who are having serious illness. So I know this is hard. It's hard for all of us. It's very isolating. But this is something that everyone has to do, and I'm really imploring those of you who are young to take heed and to help us all. We need your help, and we all benefit from your help, but we need it right now. So thanks. And then in terms of the home testing issue, we've heard of that. I mean, I think there's issues just around making sure that it's a reputable company, that they actually know how to appropriately collect the specimens. While it's not the most difficult task in the world, if it's not done correctly, then when the lab specimen gets to a laboratory, they actually can't test it. And I just want to remind folks that while this bypasses the provider, the labs really are going to be helping us prioritize the fact that when clinical providers ask for a test, that's the most important time for us to be able to make sure we could do those tests. So I understand that people want the home testing, that they want to bypass what they see as an unnecessary barrier for them getting testing, but when we have a limited ability to test people, again, this is an area where we can all be helpful. We can understand what the science says. I'm basically asking people to assume you might be infected. If you're not maybe infected today, you could be infected tomorrow, and you should do everything you can to protect others from getting infected by you, and you should do everything you can to prevent others from infecting you. And you don't need a test in order to do that. So I'm going to now ask Dr. Galley to talk about the mask.
Hi, thank you for the question about the masks. The EMS agency is fielding over 200 requests a day from a variety of healthcare providers seeking additional personal protective equipment. This includes shields, goggles, gowns, gloves, as well as masks. I know there's been a lot of news reports about N95 shortages. There are projected shortages, though additional volume is coming out of state and national stockpiles, and I know there are efforts to ramp up manufacturing in this area. In terms of what's clinically needed, the best available evidence at this time, which has been supported by a variety of clinical research papers that have been peer-reviewed, is that this particular virus is spread through respiratory droplets, large droplets. And because of that, surgical masks are effective in stopping the transmission of the virus in the vast majority of cases. The exception to that is when an individual in a healthcare facility is undergoing an invasive procedure, an invasive pulmonary procedure like a bronchoscopy or something similar to that. In that setting, the virus might become aerosolized. There was a recent study that many people have referred to recently in the New England Journal of Medicine, which shows that if you try to aerosolize the virus, it can be found in the air. That makes sense. It's common sense. If you push the virus into the air, it can indeed be aerosolized. In those clinical settings that mimic that specific situation, healthcare workers need to have an N95 on to protect their own personal health and safety. There are also other bacteria and viruses out there, such as the measles, tuberculosis, which we know are airborne transmitted and which we know healthcare workers need to have N95s for. So the best guidance right now that's out there and what is being put forward by the World Health Organization, as well as many other public health authorities, is that respiratory droplet precautions be used, which include surgical masks for individuals to prevent normal transmission, and that the N95s be reserved for those specific circumstances in which they're clinically indicated, which is what I briefly described. If we follow that, we can make sure that we are protecting our workforce for the specific situations in which they might be prone to a workplace transmission of COVID-19. Is there another question?
Thank you. Next, we'll go to the line of Robert Garova. Please state your media outlet followed by your question.
Thank you very much. Yesterday, you said the to collect specimens looks like it's going to work, and we're going to increase our capacity. So my question is, if you can get a timeline on when that will happen, how many drive-through centers there will be, and where they will be, and then I have a second question after that.
Sure, and thanks for that question. Yes, we are increasing our capacity to do drive-through, not just at the Public Health Department, but across the entire county. We have been very fortunate to have Dr. Kazan from the fire department, the LA County Fire Department. He's the medical director there, sort of agree to really spearhead our efforts to both understand what the capacity is and help enhance the capacity in LA County. So I'm hoping at some point, perhaps tomorrow, he'll be able to speak with you and announce what the system looks like today and what it's going to look like as we continue to get enhanced capacity across the county. We take the next question. Oh, sorry, go ahead.
My second question was your guidance to medical providers today talked about public health shift from a strategy of case containment to slowing disease transmission and averting excess morbidity and mortality when it comes to testing. Can you explain the reasons for that shift?
Yeah, so I want to clarify. We're going to continue to do case containment. Like, that's a strategy we always do. The shift is that we now have to add a lot of other measures. Some of them you hear us talk about all the time that are social distancing. Some of you've heard from Dr. Galley, which are just building capacity in our healthcare system to anticipate an increased demand for services. We don't want to be behind on any of this, but I do want to clarify, we will still identify positive people. We will still ask people who are positive to isolate themselves. We will still find their very close contacts, particularly their household members, and ask them to quarantine. And we'll continue to do investigations of disease outbreaks in our institutions. So I don't want people to think we're not doing that anymore. What we're doing is just adding capacity to in other places and spaces, and part of that is really asking the public in particular to help us with strategies that can only be done by everyone. At some point, your case count gets way too large to just rely on our ability to be able to manage interviewing people in a timely way, particularly the focus on close contacts. And what we'll really end up doing is being able to identify folks, get them to isolate, and get them to help identify close contacts who will quarantine, and really focus efforts on preventing outbreaks in larger institutions. So this is the time for all of us to do everything we can to support all of the various efforts, but I want people to know public health will always continue to identify positive cases and to make sure that those positive cases are in fact isolated. Yeah, and Dr. Galley is going to comment as well.
I just want to make one comment on my previous comments before we move to the next question, just to make sure there isn't any confusion. When I was referring before to the virus being able to be aerosolized and being found present in the air, that's only in the context of a clinical medical setting in which there are specific interventions being done to push the virus into the air or doing something that might push the virus into the air. The virus is not airborne outside of those settings. It's not out there in the air as you're going for a walk in the park or a walk around the block. The air is safe to breathe, and there's no indication and no clinical need to wear an N95 or a mask if you're just out in the general public. Is there another question?
Thank you. Next, we'll go to the line of Claudia Pashuta. Please state your media outlet followed by your question.
Hi, Claudia with KNX Radio. Barbara, I have 3 questions, but 2 of them I think are little or short to answer. Have you had any positive cases in the homeless population or in the inmate population? And if so, will you be identifying them when you put out the daily numbers?
It's a good question. The answer is no, but that's just the answer in this moment in time. We have investigated possible cases in both settings, both for people experiencing homelessness and for people who are in the jails. None of them to date have been positive. All the testing we've done has been negative, but I don't want anybody to take a sense of relief that, well, maybe this isn't going to happen in those settings. That absolutely, as with all other settings in LA County, it is highly likely that we will see positive cases in both groups, and that Dr. Galley could talk more about this. Certainly, correctional health is doing an excellent job managing both isolating folks when we're waiting for their test results and quarantining close contacts should we have positive cases. So I have a high degree of confidence in correctional health, and because we've worked with them on other outbreaks. So they do an extraordinary job managing cases and close contacts in very difficult situations in our jails. We are set up, as I noted before, should we have positive cases for people experiencing homelessness. We do already have places where people can go and they can be isolated and quarantined, but done so safely and with a whole set of services. So we're prepared. We haven't had any cases to date. And the second question?
Okay, and what do you mean by mild symptoms?
Yeah, that's a great question. So mild symptoms would mean that, you may have a low-grade temperature around 100. It may mean that you have some aches. It may mean that, your throat is sore. It may even mean you have a mild cough, but you're not coughing so hard that you're having trouble breathing. Moderate and more severe symptoms, are both, higher temperatures, but also a rapid rise in temperature would be a cause of alarm. And particularly for respiratory illness, we worry a lot when people are coughing so hard they can't catch their breath, or it's feeling very, very painful for you to breathe. And this, the distinction between mild and moderate illness, it's really appropriate for most of us, but I want to emphasize that if you have an underlying health condition and or you're elderly or you're pregnant, even with mild symptoms, we ask that you please call your doctor and check in.
Gotcha. Okay, here's the longer question. Given how long it's going to take to get a vaccine, we've heard potentially a year, year and a half, how long do you think people should be thinking about severe suppression measures? Is this something you're taking on a day-to-day basis, or are you already thinking this is something that's going to go on for weeks or months, be eased a bit, and then become more severe depending on what happens with the case numbers? How are you planning for that?
Well, because we're public health, we have to plan for the worst possible scenario and then, be very prepared to shift to much better scenarios. So yes, from a public health perspective, because it's a new virus, we're going to plan for this lasting for weeks and even months. What we're trying to do is make sure that while we're experiencing a rapid spread of COVID-19, we're doing everything we can to protect our healthcare system by slowing the rate of that spread. And having that spread happen over a longer period of time. But I think I've been really honest with everybody from the beginning, both that we don't know everything we wish we knew, and also that there's absolutely no example I can point to anywhere in the world that would let me believe that we're going to do this for 7 days or 10 days or even 2 weeks, and then life is going to return to the normalcy that we all had a few weeks ago. That's just not possible, and it's really not likely. How long we have to do significant suppression, I think, is a question about how well we do with the suppression we're doing now.
And so do you foresee a scenario where maybe some of the restrictions are eased, and then depending on what happens with the numbers, maybe we see more requests to ask people to stay at home again, and, will it go up and down like that?
Yeah, that's always possible. Those of us who are in public health, we're looking anxiously at what's happening in mainland China, where they have eased some of the restrictions and they got many people back to work to see what the experience is. I want to remind people the reason there's so much uncertainty and the reason I say it's hard with a new virus is there's no people in our communities except for those who have already been infected who have any immunity to COVID-19. So that's what makes this so different from other situations. And, some people say, if you really want to guarantee that, we're not going to see these ebbs and flows that you're talking about, you'd have to have had a lot of people who had an exposure that resulted in their immune system being activated. And because we just don't know this, I like to tell everyone, let's do everything we know how to do right now. Let's do it really, really well. Let's be attentive to the data and the experiences in other countries, but let's give it our best shot right now, and let's really dig in deep on the social distancing. And I'm gonna note that we can only take one more question, so the next one will be our last question, and then we're gonna, for everybody who's been so patient, we will do a brief review of the information in Spanish.
Thank you. Next, we'll go to the line of Steve Gregory. Please state your media outlet followed by your question.
Yes, hi, Doctor. It's Steve Gregory, KFI Radio. Thanks again. So I want to talk a little bit about numbers, and I want to find out if you think it's necessary to every day give us the numbers and why you think it's important. People need to hear these numbers every day of cases. The other thing is the Centers for Disease Control, they put out their numbers, but they seem to be a little behind, and there are multiple sources apparently for positive cases around the country, Johns Hopkins, CDC, WHO. Who do you use as the agency in Los Angeles County? Who do you use for the ultimate sort of clearinghouse for data? We're trying to really figure out where are the most accurate figures coming from when it comes to positive cases. And do you think that we should be promoting those positive cases on a daily basis?
You know, it's a great question, and I think I'm going to try to answer the first because I think it informs how we think about the second. So what's the advantage of letting people know every day the number of positive cases? You know, I think at this point we'd like the public to be assured that the information we have, they're able to access, and that's why we do it. We know that there's a lot of anxiety. We know that people are very worried, and we know that one question on the hearts and minds of so many people in LA County is what is happening with the number of positive cases, and we're happy to provide that information. You'll also notice we use this as an opportunity to talk about all the other issues that really we like your viewers and your listeners and your readers to pay attention to as well, because this is an opportunity, thanks to all of your cooperation, for us to be able to talk about how people can take care of themselves and the people they love and those most vulnerable. I will say there's always this limitation on reporting numbers, because sometimes it gives people a false sense of security. You know, it was our fear when we started reporting the numbers by the cities, was that people would look at it and say, well, this isn't in my community, so I'm not going to do anything that they're telling me to do because there's none of it here. And that's also the problem with the case counts, is it's an underrepresentation for sure of the actual number of cases in any community, and certainly across LA County and the country as a whole. And everyone has said that if you have limited testing and you also have a lot of mild disease, which means people may think, I just have a cold, this is my usual, you know, March cold, I'm not going to worry about it, which is very appropriate. In this case, it may not be the cold. It may actually be a mild case of COVID-19. So knowing that, and knowing that we've had a lot of testing limitations, means that what the numbers don't tell you is the true experience of how much community transmission we have and how many cases or how many people in our community may be positive. So knowing that, I'll go to the second question, which asks, so, you know, where are you getting your information from? One thing I want to note is everybody must report to their local public health departments all around the country positive cases. And if you're looking for reliable information in LA County, we confirm all the cases, and any data we give you are for confirmed cases. We also work closely with our state Department of Health, the California Department of Health. We all feed our numbers to them. So I would say state numbers are very reliable, local numbers are very reliable. Sometimes there's a lag with reporting to CDC, which is why sometimes if you were to add up all of the state numbers, they wouldn't exactly match the CDC numbers. But I do know that the local numbers are very reliable from local public health departments, and the state numbers tend to be just as reliable because they are collecting the information from the locals. So thanks for your question. I think we're now going to go and switch to Spanish. I guess, do we need to give everyone a minute? We're good to go. Okay. So, Buenas tardes a todos. Hoy estamos reportando 40 nuevos casos. Estamos tristes de reportar una muerte adicional hoy. Esto lleva el conteo a 2 en el condado de Los Ángeles. Quiero expresar mis más profundas condolencias a la familia y los amigos. Lamento mucho su pérdida y nosotros como comunidad lloramos con usted. El número total de casos en el condado de Los Ángeles hoy en día es 230. Todos los casos confirmados están siendo aislados y los contactos cercanos están en cuarentena. Veremos un aumento en los casos positivos probablemente para las próximas 4 hasta 12 semanas. Pero eso no significa que nuestras acciones para combatir el virus no están funcionando. Sí están funcionando y es bien importante que para todos practicamos el distanciamiento social. Debemos emplear precauciones en todo lo que estamos haciendo. Una forma de tomarnos en serio la desaceleración del virus es que todos practicamos el distanciamiento social y cumplamos con todas las órdenes y las pautas que estamos dando. Debido a que COVID-19 está muy extendido, como regla general, debe asumir que puedes estar infectado y que otras personas a su alrededor están infectadas. Y actuar con esto y a tomar todas las precauciones posibles para evitar infectar a otros y evitar infectarse. Si todos adaptamos esta mentalidad y luego actuamos lo que estamos pidiendo, reduciría la propagación de este virus y mantenemos a usted y a su familia más seguros. Quiero hablar por un momento de la necesidad que todos estamos aquí juntos y tenemos que cuidar uno al otro. Si nosotros necesitamos cuidarnos y cuidarnos a los unos que están alrededor, porque este tiempo es un tiempo bien difícil para mucha gente. Si usted o un miembro de su familia tienen síntomas leves, puedes hacer algunas cosas en casa para cuidarse. Descanse, bebes mucha agua y controle su fiebre con Tylenol, si es seguro para que usted pueda tomar Tylenol. Aislar durante 7 días, utilizando su propio baño si es posible. Es bueno hacer planes ahora para que estás preparado para esto, si esto se empieza en tu casa. Si tú te sientes mal o tienes un hijo o un miembro de tu familia que se siente mal. No comparte utensilios, tazas o alimentos con otros. Si usted es un cuidador de niños o de gente que son más ancianos, trate de encontrar a alguien más en su familia para que ellos puedan hacer el cuidado a todos. Y por favor, no evites de preparar o servir comida cuando tú estás enfermas. Si sientes que necesitas ver a un médico, por favor, llames antes que ingresar al hospital o al clínico. Es especialmente importante que las personas mayores y las personas que tienen problemas de salud graves se quedan en la casa. Le pido que a todos de nosotros que tenemos familia, que quizás están ancianos o quizás tienen que quedarse en la casa, que le ayudamos para que ellos sí se pueden quedarse en la casa, porque nosotros estamos ayudando para que ellos no tienen que salir para hacer las compras. Si necesitas hablar con alguien porque tienes mucho estrés, Puedes llamar a la línea de ayuda 24/7 del Centro de Acceso del Departamento de Salud Mental del Condado de Los Ángeles. Ese número es 800-854-7771. Muchas gracias. Y puedo coger unos pocos preguntas también. Tenemos tiempo, ¿verdad?
Grace, we will take any questions in Spanish now.
Thank you, ladies and gentlemen. If you wish to ask a question, please press 1 and then 0 on your telephone keypad. You may withdraw your question at any time by pressing the 1-0 command. If you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you wish to ask a question, please press 1 and then 0 at this time.
También le quiero decir que si quieren hablar con una persona después, pueden llamar a la Oficina de Comunicaciones del Departamento de Salud Pública y podemos tener a otra persona que te puede hablar también más tarde por hoy. Y se parece que no hay preguntas hoy, so muchas gracias a todos.